Okay, so that brings me to the last experiment I want to talk about. I just presented these data at the dairy science meetings in Phoenix, Arizona this last summer. And so what we really wanted to do in this experiment was to say, if we've got these two different tools, if we have the ability to synchronize cows and we have the ability to detect cows in estrus based on one of these systems, how would we merge those two technologies in the best way to get our cows pregnant? And so again, this was on Majestic View Dairy, which I showed you before, and we randomized the cows to 3 different treatments. We did this experiment across the course of a year. So we ended up with over 300 cows in each of these treatments. So treatment number 1, from a philosophical standpoint, is what I would consider kind of the low hormone therapy type of a treatment. So what we're going to do is the cows are going to have a voluntary waiting period. That voluntary waiting period is essentially 50 days. At the end of the voluntary waiting period, we're going to use the accelerometer to detect estrus activity. We'll breed any cows that show an estrus to estrus activity. And then any cow that doesn't show estrus during this period, we're going to go ahead and we're going to put her on a synchronization program. And this is relatively aggressive. This is about the interval from the end of the voluntary waiting period till the start of off-sync in this particular treatment is only about a half of an estrus cycle. And I want to come back and show you how we dealt with that a little bit more in a few slides. The second treatment then is a very common synchronization protocol that we use in the United States, widely used in North America, I think used here in Europe as well. This is what we would call a pre-sync off-sync program. So the off-sync part of the program is here on the right. And what we do is we give 2 injections of prostaglandin 14 days apart. We would set the voluntary waiting period concurrent with the second prostaglandin injection so that the cows that come into estrus after this prostaglandin injection are detected in estrus with the activity monitor and are inseminated. And then any cows not inseminated then go into the off-sync part of the protocol. The third treatment then was an important control group, and that is it's identical to treatment 2. We knew which cows showed estrus activity in treatment 3, but we elected not to breed any cows regardless of whether or not they showed estrus. All cows in this treatment received all 5 of these injections. They were completely synchronized, and 100% of the cows received a timed artificial insemination. And so the way that this is set up is we've got concurrent off-sync parts of the programs, and we have concurrent then estrus activity periods in these 3 different treatments.